but forget the recordings on, and we could just talk as you would know. No, I'm not here to say anything in particular. This is really about responding to any questions that you have. So yes, by all means, just fire away if you've got any questions, or maybe tell me what your professional background is as well, and what stage you're at regarding this. Who wants to go first?
I can if you want.
Yeah.
Yeah. So I've been a GP for 30 years. I'm now a very, very part-time GP. I was sessional, and basically the funding ran very dry. So I'm now doing 1 day a week for a nice practice in the centre of Blackpool. And I've gone ahead with I'm BMAS trained for acupuncture. So I'm making that a sort of private enterprise, because I've done my best, and I've also had some lovely GPs try and help me on funding committees, but and I've met a colleague who tells us about the work she's done through SERPA, and I was quite intrigued.
Which colleague is that, out of interest?
Lady up near Leeds, Charlotte Gammins. She's a nurse practitioner.
Yeah. Yes, Charlie. Yeah. Right, lovely. Okay, thank you. Is it Dana or Dana?
Dana. Yep.
Dana.
So I am physio. So I've been working for about 10 years. I'm up in Aberdeen, in Scotland, and I do outpatients, and very general. We see absolutely everything, and chronic pain is something I just really struggle with. And I've done our in-house training, and I just don't think it works, or I just think there has to be a better way to treat chronic pain. And it's more, I've sort of read around the website, but just wondered kind of what was more involved in each section. Can I start using it from day one? Is there any sort of assessments? I don't know that anyone at work has done it, because we're all just taught the same way, and it just doesn't sit right with me. And I think I've had issues with mental health in the past, and I've done a lot of work on the nervous system and all of that stuff, and all that side of things seem to suit me a lot better and make sense. But I'm not allowed to use any of that stuff that I've done on courses for me personally, because there's no certificate or anything that around it. So it was to formalize stuff, or just look at how to treat it differently, because they just stopped coming back to me. So I think there has to be a better way than the way that we've all been trained within our teams at work. But I'm not allowed to say that out loud. So yeah.
Yeah, we've recorded this, but yes.
Yeah.
Oops. Sorry, won't send it out publicly.
No, thank you. Yeah, not to NHS Grampian. Yeah.
We actually have a lovely group of practitioners in Scotland, and I can't remember exactly where in Scotland, but they are spread out a bit. Very involved, very interested, a few physios as well. It might be worth your while connecting with one of them, or more than one of them. So yeah, it's worthwhile, especially if you do the training. Then they have a Scottish group of practitioners doing our training. So again, that's another way to get peer support. You're where I was in the past when I left the NHS, which actually was, when was it? Back in 2005, so 20 years ago now. I was just getting so frustrated. And it did feel like, this, what do they call them? These clients that just keep popping back. And you just can't help them, and because we're trying to treat the symptoms rather than the underlying cause. And it was just so frustrating. And I was learning more complementary therapies, actually, and I really wanted to use this more. In fact, it was my husband in the end, because I wasn't able to use it much within the NHS, who just said, well, stop moaning about it and do something about it. And as I, at that point, was working in the community, I started doing some community work here. And it was through giving people more time, having more time to listen to them, to talk to them, which evidence now shows is you get a better outcome, that I began to realise there was so much more to this, and various other things helped me with, for example, leaving the NHS and then waking up one morning with severe sciatica. Like, oh, well, it must be the mattress, mustn't it? Even though I'd slept on it for decades, no, probably not decades, but anyway, luckily that was a point where so I had a client with a really challenging presentation with basically pain predominantly down the whole side of one body. So it really wasn't, didn't fit functionally with any particular condition. It was all over the body, but mainly down the left side. And I remember going on our interactive physiotherapy website to ask a question with the patient's permission and just saying, what do people suggest? And I'd said to her, I don't know that I can help you, but we'll give it a go, because I was using Bowen therapy by then. And some people were suggesting craniosacral therapy. Now, I'd just come across a craniosacral therapist who thankfully ended up being a very intuitive person who did a somatic emotional release as well. And so I asked if I could sit in when I recommended it to this lady. And I did sit in. And one of the questions she said was, so what was going on in your life when the pain began? Now, I don't know if either of you two have ever asked that question, but I had never asked that question in the past. Yeah. And this woman was saying, oh, well, my husband died. She'd had this pain for 7 years, and it came on soon after her husband died, and mainly over the heart area, the left side. But she was not ready for this at all, and she never went back. I'm sitting there with my sciatica thinking, wow, this is really interesting. And I ended up saying, can I come and see you? And it took 2 or 3 sessions. And basically it was leaving the NHS, not having a monthly salary, stopping that pension. My husband's self-employed. I've got young mid-teenagers. And it took 2 or 3 sessions, and that was it. The pain went. And yes, she was doing her craniosacral therapy, but it was the feedback I was getting as well. And so that question I started to ask all the time. And then it was that becoming just more and more interested in all this and understanding it, and then finally coming across Dr. Sarno's work. But it is a challenge, especially working in the NHS, whether you're a GP, you're a physio or whatever. You have more at the moment, because we're not accepted sort of necessarily working within the NHS. So again, it depends on the pain clinics, because some pain clinics, they are using this. And many of the pain clinics are also very much on board with Lorimer Moseley, Peter Sullivan, all the up-to-date neuroscience. And if they're not, they really should be, because that evidence has been around for 15, 20 years. So it's easier to bring it in now. The fact that the pain reprocessing therapy and the emotional awareness and expression therapy research has been done now means that you show the evidence. They cannot say we can't use it. Difficult if you're working within a group, though, an actual clinic, if nobody else is doing this. So on the whole, it's easier to do this work privately, I have to say.
Yeah, and that's I think where I'm headed. I think, because we're in a room of 6 beds. You can't ask people personal stuff. You can't, it's half an hour, 40 minutes new, half an hour return. There is no leeway on that, so there is no. Yeah, I just don't see it working unless I make a case and present all the evidence and all of that. But yeah, so I'm not sure. That is a thought I've had, a big thought.
And it is certainly, we have a group of people who work within the NHS, and they sort of support each other as well. I'm thinking one physio at the moment who just really struggled to get this accepted within the work she was doing. And so she set up privately, and but she was still finding it a real struggle, because we want everybody to get this, don't we? When you really see it, it's like you can't unsee it. And yet, sowing seeds, there are still people that just don't get it, even though there's so much evidence now. But it does depend where you're working. But I would definitely, if you, I always say to people on these calls that email me tomorrow, because don't expect me to remember exactly what you asked and what you're wanting from me. But if you email me, I can give you a couple of names of physios in Scotland. I'm trying to remember whether they are both NHS or private or both, or I I can't remember at the moment. I know they do both work privately. Whether they're still in the NHS, I'm not sure. But there are people there, so we can put you in touch with them, because I think it can just be helpful to talk through with somebody who's gone through that journey themselves or going through that journey themselves. Do you want me to explain about the different levels then of the course? Is that what you think?
Please, yeah.
Yeah, that helped you
Definitely.
Okay. Yeah. Okay. So we have a 3-level course now. So level 1 is now experiential. So we relaunched the training, updated it completely, because there's always new evidence, and we really felt that we needed to update it and bring in the new evidence and the new work that we were doing, which is working on a more somatic way of ensuring that patients are safe right from the word go. Rather than just saying, certainly 20 years ago it was after 18 years ago when I started doing this work, came back from seeing Dr. Sarno, and the idea was that journal about, understand it all, but journal about your past traumas. And no wonder that got the backs up of psychotherapists and even physios thinking, oh, no, I can't do that. Because they could be journaling about something that they haven't thought about for a long time. And for some people, that could be overwhelming. So we used to deal with this, but now we work in a much safer way, using breath work, using resourcing, self-soothing the nervous system. And basically, the trauma research alongside the pain research has really helped in the way we're working now, because we can use those. So we would, right from the word go, ensure that they know how to self-soothe, how to use calm, connected breathing, which again, the evidence is there for how it helps calm the nervous system. And then they learn to acknowledge emotions, but we pendulate them from, so that they can actually deal with not big emotions initially, but they get used to feeling an emotion coming up, which might normally panic them, or they're not even aware of it because they can't go there, but we're teaching them to pendulate, so to build their tolerance of feeling emotions. Because if the pain is because they're not acknowledging the emotions, then, and they're not even aware of them often, and that's been shown to be very strongly linked to alexithymia, which is not really being able to identify, understand, explain emotions. That's very linked with chronic pain. So if we can get people to really develop their felt sense, and become really more aware of when they've been triggered or an emotion coming up, then you can catch it earlier than just treating the pain, just working with the pain when it's there. So the sooner we can get into it, the better. So we also found that a lot of the practitioners coming to do the training had their own chronic pain issues or other neuroplastic conditions, whether it's tinnitus or fatigue or whatever. And having said that, even if you have never had anything like that, we have all had mind-body symptoms, sensations, for example. We all blush when we're embarrassed. We all have, whether it's a hot flush or whether it's a reaction to something, the mind-body is constantly at work. And the more we understand this on a personal perspective, the easier it is for us to be empathic and understand it for our clients. So when we had the initial 2-level training, it wasn't experiential, but the first level was already, almost everything in there was the same as everything in the patient's online recovery program, okay? Because whether it's practitioners or patients, we need to know the understanding of the nervous system. We need to understand pain science. And so therefore, we decided to use that online recovery program, adapt it for our practitioners so that they're learning the first part of all this experientially. Okay, so that's the start. Level 1 is what it's 25 hours. Having said that, all the CPD hours are the basic hours of reading, listening to videos, whatever. And it's videos, audios, there are links to other things to read. And that's the basic time. But obviously it's an experiential course. So if you really want to work on yourself, and many people do, then it can take longer. And we can't say how long that will take because that's an individual thing. And we've had a few people who have signed up with quite significant chronic pain or chronic conditions. who have gone through level 1 and then decided to work with one of our experienced practitioners, so that when they move on to level 2, they are in such a better place to be able to then start working through and looking at it towards helping other people. Okay. And we have some amazing practitioners who've come on and done their own journey, worked with one of the practitioners, and then they've gone on and carried on with the training and become really exceptional practitioners. So once you've done level 1, then you move on to level 2. And the level 2 is a bit more in depth. There's more, you can't do level 2 without doing level 1. You can't do level 3 without doing level 1 and 2. And GPs, physios are eligible to do the full 3. But we do have SERPA-informed practitioners who do level 1 and level 2. But if they're not eligible for level 3, they remain as SERPA-informed. To be eligible, you need to have a health professional qualification, and whether that's GP, physio, osteopath, psychotherapist, counsellor. And if not, they can be a coach. But then we're a little bit more careful as to what coaching, because somebody's been on a month's coaching course and actually not seen clients yet, then no, that's not the case. So it needs to be a diploma, minimum of 6 months, have done case studies with supervision, and be able to work as an independent coach and be regulated and insured. Okay, so that's so that we can really ensure that the public are safe and the practitioners are safe, because they're used to working with clients. And because remember, these are CPD courses. These are not full professional qualifications. Okay, so people going to do this training, it's because you already have that experience working as a practitioner in your own field, professional field, and then you can go on, and this is a CPD qualification. Okay, so level 2 goes into some of the trauma, understanding about trauma, goes into some of the somatic practices that we use, and goes into more about the pain science. We have a section where we have some of the practitioners who are working as SERPA-informed practitioners who talk about how they integrate it. So there's various different sections within that level 2. And then the level 3 is more you've got all the understanding now, let's put it into practice. So the level 3, you have to demonstrate you are eligible for level 3, otherwise you can't access it. And then this is, going through some of the somatic practices and some of the treatment things that we use. It's actually learning those. It's listening to assessments. So there are 2 assessments. One I did, one Carol, who's a psychotherapist and who's on our membership board, one she did. So it's a recording of that assessment, but you also get the written assessment forms beforehand. And then there's an assignment where you look at those forms and you look at, okay, what would I want to ask them? And what do I think might be going on, etc. Then you listen to it and then you plan out what you would do moving forward from there. So that's a sort of big chunk of the second of the level 3. And then we've got practitioners there who've recorded how they integrate this work. So there's physios working within the NHS, there's GPs, osteopaths, or whatever. There are assignments at the end. The initial assignments are ones that you just do on your own. There are 3 questions right at the end based on clients, real clients, and asking questions about what would you recommend they do. And that's really just for us to get some guidance, an idea as to what you've picked up, how you've done. Also, at the beginning of each level, there is a questionnaire. Actually, I don't know if there is in level 1. Anyway, level 2 and 3, I think there is in level 1. And it's really just for you to gauge at the beginning of level 2 where you're at, and then it'll be the same questionnaire in level 3. So hopefully that's marked then that you need to get 80%. But the assignments generally are ones for you to work through until the end, and then they are ones that you undertake, you submit them, and then we will assess them and get back to you. Okay, and then once that's completed, then you can and you can then start on your case studies. So the case studies are separate. That's part of level 3, the 30 hours is level 3. But this is you working with some 5 case studies with supervision. And the supervision costs are the only additional costs. with doing the training, because these are some of our SEPA practitioners who are professionals in their own right, and they've also done a clinical supervision course. And they're excellent. The feedback from them is excellent. And we include supervision now within our annual membership as well. You get 2 months free membership through the training that you can sign up to at the beginning of level 2 if you want. And then you can see what is involved in the membership. And I can tell you a bit more about that later if you want. How does that sound so far? Any questions around that?
It sounds like level 1, although you mentioned 25 hours, there is the scope for you to take more time over it if you feel you need to.
Yeah, you can take as long as you like over any of them. There is no deadline. You'll get the odd email, but it's automated, so don't worry about that. And it's just us saying, how are you doing? I hope you're enjoying it. And so many people email me thinking that I've reached out, and I feel bad saying, I'm really sorry, that was an automated email. But it's lovely because it means I get to hear from people, and then I can feed back to them as well. But, some people stop because, I don't know, there's been an illness in the family or something happens, and some of them can take months before they get back to it, depending on the circumstances. So it's there for life, okay? So you've got access. Once you've purchased it, you have access to it, and you can dip in and out as and when you want to. The only time involved is that when you've completed level 3, we say that case studies need to be done within a year of you completing level 3. And that's only because if you go off and come back maybe 2 years later and say, can I do, right, I'm going to start my case studies. We don't know what you've been doing in that year. You might have forgotten everything that you've done. It's on an individual basis. So if it does go over a year, and we've had people where it's gone over significantly, all we would do is say, okay, where are you at with this? What have you been doing? Some of them we know because they're still members, they're involved in the community. We know that they've gone on and done a trauma course, for example, or they're training to do IFS. So in internal family systems therapy. So if they've been working within this field anyway, then that wouldn't be an issue. Okay, but if somebody has gone off, as somebody recently did, for a few years because there was significant ill health with their parents and then something else happened, then it's like, okay, so you can, but we require you to work through level 2 and level 3 again, just to make sure that you're obviously not going to study it as before, but just as a revision, do that before then going on and doing case studies. We're not going to just say no, depending on, I suppose, we've never yet said no. It depends on the circumstances, but we're trying to support everybody depending on, what their circumstances are. Anything else?
No, not that I can think of right now.
No,
it's straightforward. Yeah. You played it out.
Yeah. And the membership, you can have that 2 months free membership, and it's your choice whether you carry on with it or not. At the moment, it is £25 per month. I have to say that might be changing, as may the costs, because unfortunately we've had to go VAT registered. So I have no idea when anything's going to change at the moment. It's been backdated, but we're having an advisory board meeting in a week or so. So that's something we will be discussing. And I certainly do not want to add all of that onto the courses. That's not what, we need to look at how can we keep the costs down. But it may impact membership as well. Again, I don't know yet. We need to discuss this. But one of the main things about the membership is the membership group on Facebook, which is a very active group. And I know it's me saying this, but we haven't got anybody else. Sometimes we have other practitioners who join us with this, but we have a very supportive group of members. And nobody is made to feel like they're stupid if they're asking a question that they think they ought to know, whatever. The feedback's excellent, whether it's somebody just saying, I've got an autistic client, or, and I've done this, can anybody recommend something else? Or is there somebody with experience working with autism? Can I refer somebody on? Or I'm really struggling with this client. this is what's happening, what can I do? You know, there are lots of opportunities for peer support. So the membership group is the big one, the main one on Facebook, and we share everything in there, any new studies, anything that's going on, and people can go in and as I said, and just ask questions. But we also have loads of peer groups as well. And this has grown a lot in the last couple of years, partly because I kept saying, you know, if you want another group, you set them up yourselves, you know, because it needs to be organised by the membership. So we have a group of physiotherapists who meet, I think it's every month. We have a group of doctors, a big group of growing doctors, actually, that provide peer support. We have a group for osteopaths, coaches, psychotherapists and counsellors. So they all arrange their own meetings. Somebody moderates them, and anybody can let us know if they want to join those groups. We also have regional groups, like we have our Scottish group. We have a German-speaking group. What else have we got? We also have some online groups. So we have physical locality groups. So rather than just being occupational groups, we have a Yorkshire group, we have a West and a South Yorkshire group, because Yorkshire is so big. I'm trying to encourage the Southwest to set their own group up, because there's quite a lot of them down there, but haven't as yet done that. And again, it needs to be with somebody in that area who'll set it up. So there's always places to go. And if you're, for example, if there's somebody who's got a question in the Yorkshire group, they might just put a post in the WhatsApp group and just say, rather than in the membership group, maybe they're not a member, but they can still be a member of one of the support groups, and then they can go in and just ask whatever questions that they have, or share something that they're doing. Or the other thing we also do is we encourage people to buddy up with somebody else on the training. And again, we can't organise it because everybody's doing different things and at different stages. But we highly recommend that people buddy up with somebody else. It doesn't have to be their own profession. In fact, we have two of the people on our membership board, Carol and Iralee. They started both in 2020. Iralee is a physiotherapist, Carol is a psychotherapist. They both started at the same time, and they buddied up to work through the programme together. And then they buddied up to assess each other. And I think they used each other as case studies, one of the case studies. So they still are good friends. They still buddy up. But also Carol has psychotherapists she buddies up with, and Iralee has another physio that she buddies up with. And now we're all in the membership board. We've been going for years now. We all support each other. But it's having that, you know, there's no hierarchy within SERPA. We have a fabulous annual CPD weekend, which again is coming up in beginning of November. That's always popular. And that because we get to see each other. It's like the conferences. You actually get face-to-face with people. And it gives people an opportunity to get together and really talk about things. You know, we get ideas from the membership as to what sort of thing do they want to work on, and then we have time for talking with each other. We have time for going through certain seminars and things, and do group work. We go for a walk on the Friday afternoon when we arrive. So it's just a really good opportunity for people to start to meet each other face to face, which is really helpful. And some good friendships get develop. And it's just lovely to speak to somebody who understands, you know, where we're at. You know what it's like. You've got, like you've said, Dana, with your colleagues, and you know, when you've got colleagues around you who really don't get where you're at, and family and friends, it can be a lonely place, which is why we have so much peer support these days.
Yeah, no, sounds good.
Yeah.
Anything else that you want to ask while you're here?
Oh, I know a lot more now than I did. So that's really helpful.
There's, out of interest, as you're both thinking of doing some private work, whether you do or not, but we do have a section about business as well. So how to attract clients. Just because you're on the website doesn't mean you'll necessarily get clients, for example, but what you can do yourself to be able to attract clients. some other business stuff, setting up businesses. We also have Zoe Thompson, who's worked with SERPA for 10 years now. She worked in the office with me for 7 years. Then she's a hypnotherapist herself, but she worked in the office for a while. She's on the membership board now as well. And actually, she's back in the office again. Only once a week at the moment, but we took on somebody who really wasn't a good fit. So Zoe's back supporting me at least till the end of the year while we find somebody else. And she left SERPA to work on her own business called Build It Brilliant. And so she actually specifically works with people to develop their own businesses. So, or if they've already set up their own businesses, looking for some of our practitioners, it's been helpful for them to sit down with her and look at, how do you want to work? How do you see this working? Or maybe they've just been really struggling to know how to fit this in, and are they going to work online, or are they just going to work face to face? Do they want to travel? How can they fit it around that? And she's brilliant at really being able to get out from people what it is they want, so that they can then focus on that. She has people that help her with websites and SEO, but she's exceptional at helping people find easy ways of working through things. So there's always that extra support if necessary.
Is this course known, like you said, there's a German group? Like, is it used throughout Europe? Is it used further afield, or is this a British course? That's not really a very good question, but
no, it is. Yeah, no, it's a British course, but we have had people. We've got American practitioners. We've got some German, a couple of French. We have a French-speaking group as well now. When we developed the French-speaking and German-speaking group, because we had our conference in May, and we had people from Europe coming over, plus before then people were saying, oh, I don't know anybody in Germany. There was one particularly, I don't know anybody in Germany. Do you know any German-speaking people? So yeah, absolutely. So by the time we got to the conference, we'd already connected a few, and after the conference, I think they've got about a dozen in their group now. Yeah. So on those peer groups, we don't limit it to just SERPA because they're so isolated anyway. But in fact, we are part of a global group because, we first met in 2009 in America. There were only 35 of us at that point, and it's from then that this movement evolved. And last year they started doing an annual American conference. We've been doing conferences here since 2015, and the American profs come over to the UK always to support us with our conferences, and then they invited me back to speak at their first conference last year. So, this is all and we've got the Emavere, which is the Dutch organisation. They're doing incredibly well, and we have a meeting, tomorrow with Living Proof, which is a not-for-profit organisation where they're really trying to get out there to raise awareness with doctors as well as in the public. And so we're looking at how can we work more together? How can we collaborate more? And then they have the American conference at the end of September. And one of the main things there was how can we get this even more, collaborating even more, so that people can go to one site and think, okay, yeah, I can go to UK for this, I can go to Holland for Mavere. So, there's a lot of collaboration. And in fact, we are bringing Howard Schubiner over in the spring. He's coming over to run some courses for the public with us. Mavere, I've done that a few times. So actually, tomorrow is the meeting with Marion, who's heads up the Emavere Dutch organisation, and Living Proof and us, so that we can talk about what are we going to do to help promote Howard's book, which by doing that, he's the main sort of scientific leader in our field. But he's a great clinician and he's fantastic anyway. So what can we do when he comes over to raise, so that it helps us raise awareness in the UK and Europe as well? And he's also going to be speaking on Rangan Chatterjee's podcast as well. So it took 2 years to get him onto the first one, which he did when he came over to 2022, I think our last conference was, previous one. So he spoke then, and it's been one of the most watched of the podcasts. So he's coming over, and when we're liaising with Rongan, whom I'm going to meet on Wednesday actually for something else that we're developing, and he's going to be getting Howard on his second podcast as well. So that all helps as well. So really things are beginning to really move forward now, and something like that and a documentary they're doing with Rongan is going to really help raise awareness even more.
Yeah, that's pretty cool, isn't it?
Yeah, yes,
yeah.
To join.
And can I ask then as well, like, how does this fit with like the pain reprocessing therapy, or is this a similar type of
same
but different, but just packaged slightly differently? Or
it's interesting because that always comes up, and that's good because we're all in the same movement. So Alan Gordon, who developed PRT, was in the core group of 35 of us who were in this meeting, the first ever meeting that we had in 2009. And it was really interesting. It's been interesting watching all of them evolve. Like Dave Clark became the president of the ATNS, which is the American organization. Howard Schumer has ended up doing a lot of the research about this and running his own courses. Alan Gordon then developed PRT, and then his study about PRT, the Boulder study, basically our movement crowdfunded to be able to run that study and to create the documentary about that study. So it's very much part of our field. So some of our practitioners have also done the PRT training. The PRT, we although we don't teach PRT as such, we teach the elements of PRT. It's just part of what we do. Howard Schuber uses EAET, emotional awareness and expression therapy. We use the elements of that, but in a different way, rather than the quite intense sort of psychotherapy side of it that they use based on ISTDP psychotherapy. So yes, it's incorporated within our field, within SERPA's training, all the different elements of it, basically. We use emotional awareness and expression, but not the EAT. And for example, PRT, he suggests that if your pain's really severe, that you use avoidance strategies rather than using somatic tracking and observing resting your attention on the pain. Whereas the only difference would be is that we would say we don't get people to avoid it. We go in then to do breath work and self-soothing and emotional awareness work, because then that brings the pain down, and then you can use the somatic tracking and things with. So PRT is just part of what we do within our training.
And I'm hogging all the questions now, but I had this chat with one of my seniors about the kind of psychological aspect of pain, and just how, like, within Aberdeen, if they're level 1 and 2 or something, physios are allowed to treat them. If they're level 3 and 4, I'm not sure what the levels are, but there's too much psychological background and they're not for physios to treat. So do you feel that with the right skills, we can actually help anybody without necessarily having to go down, like, digging up the past? Or
and that's where the PRT comes in, where the somatic work we do comes in, because what we say is we're working with the physiological response to trauma. We are not working on the trauma. This is not talk therapy we're doing. We're teaching them somatic tracking. We're teaching them emotional awareness, breath work, mindfulness, meditation, journaling. That's not psychotherapy. And this is the nice thing about the PRT studies coming out, and the Lauren Mosley and Petra Sullivan's work, because this is teaching physiotherapists how to work with people with chronic pain. And yes, there are some people who might come to us who maybe have severe depression and anxiety or significant past trauma. And that's why now we have so many psychotherapists who are trained, then we can just refer on to those. But there are many people, for example, it might be that somebody has had significant trauma and has had years of psychotherapy, but has not had any impact on the pain. And that's because if the psychotherapist nor the client themselves has an understanding of this concept and approach, then it's not going to really impact the pain anyway. So sometimes then, even if they've had significant trauma in the past, if they already have a good understanding about their personality, their learned behaviours and things like that we teach anyway. But if they already come with that, quite often they can respond really well and very quickly without going into the trauma. That yes, they write a timeline and they'll look at the different things and make the connections, but we're not using talk therapy.
Yeah.
So we work very much focused, and this again is in level 3, is both levels we're talking about scope of practice, so that everybody needs to work within their scope of practice, and about how to work safely. We have a section in level 3 and level 2 about burnout, preventing burnout for us, because we are talking with people who've experienced trauma or are anxious or whatever, and so it's about looking at how do we protect ourselves, rather than just sort of working with the patients and listening to what they have. But so much of the pain science is by physiotherapists. Lorimer Moseley is a physio, Peter O'Sullivan is a physio. They are teaching people how to work with people with chronic pain. Just because we then include an awareness that past trauma can have an impact on chronic pain. So you could do PRT, okay? And that's definitely not going into the trauma or even much into the emotions. That's brain retraining. So that's not going to cause a problem. And what we do is we work on the physiological response. In other words, whether somebody has probably had past trauma for many years before they develop chronic pain. Okay. So this is not just, we don't have to necessarily go there. We can look at what triggered you, okay? And it might be that there's a trigger linked to that past trauma. But what we do is, using our somatic work, it's actually being mindful in that moment, going, okay, you've been triggered. What's going on? How are you feeling? What are you aware of? And being able to just sort of express that, how we're feeling now. Then even just making that connection, well, you've learned that from your previous experiences. Again, it's not talk therapy. The body cannot explain in language to us. So it's explaining in sensations. And when unconsciously that link is made, then often that is enough. And if they need or want to talk about specific trauma, then we can refer on.
Because I'm going to be intrigued. I mean, since September, I started doing private. It is heaven when I get to just sit and listen sometimes, put the needles in and listen to patients. Thursdays are a little trickier with still 15 people twice a day, 10 minutes each.
And yet the research has shown that the longer we can spend with people, the more time that they can listen to. The research shows that they have better outcomes. And yet we're still just in, out, in, out.
And
the latest system's called total triage, and that's all it is. It's just, make sure they're not going to die on us so we don't get sued.
Yeah.
And no time to do anything. And it's such a shame.
Yeah. Well, there are, we've got GPs that are working very much within this field who are SERPA practitioners, Kath. So again, email me tomorrow if you would like me to put you in touch with one or two of them.
Yeah, thanks, Georgie. Absolutely.
Because I think it's easy to hear from somebody who's doing similar sort of thing to you. Professional, especially if it's East NHS. I know we've had a few who really found it so frustrating you really, if you're working as a GP with 10-minute appointments, then you're really more working as SERPA informed. It's about giving them the information, giving them a leaflet, making suggestions, and offering them resources that they can go and look at. It's not easy to work with somebody as a practitioner if you're a GP working as a GP in the NHS.
But if we don't all try to change the system, nothing's going to change.
Absolutely. And we have, I think, a big group now. I can't remember now what Sarah Hadfield set it up, and I can't remember how many she told me, but it's a massive group now of not just SERPA practitioners, but doctors working within the mind-body field who just want to get together, and they're trying to set up an association for mind-body conditions. So, there's a movement going there as well.
Yeah. But isn't it amazing how the system shouts that it wants evidence, 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 and when you present evidence contrary to tradition, they don't want to hear.
No, yeah. And yet how much is being done without any evidence? I mean, you know, I think of electrotherapy, working as a physio, ultrasound and other electrotherapy, and actually there wasn't any real evidence demonstrating that was effective. And then towards the latter time of me working in the NHS, they started pulling out all the electrotherapy. So, yeah.
And I think it's time, you know, like everything is timed. But like if you put time into certain groups of patients, you wouldn't keep seeing them again because they just keep coming back because they're no better because we've not treated them properly. So yeah, if we could put time into them, then they wouldn't keep reappearing.
Absolutely.
And I was just and I was just laughing at you saying about the trauma stuff, because someone I work with, she'll be like, if we have a chronic pain person, and she'll be like, have you opened that can of worms? Because there is generally a background to the patient. And I listen to her sometimes and she opens the can of worms, and then it's like, there's no way to deal with that because we're not trained to do that. And I've had enough, hence why I'm here. But yeah, it's just amazing. So there has to be more, and maybe this is it potentially.
And so, you know, working with groups of people, you know, if you're working in the NHS, and I know that, and I can't remember her name now, which one it was, but a physio working in a pain clinic where she was given permission to work with a group of people. And then she was able to take her case studies from that group because there were so many of them that really fitted with this. And she was able to do that on the NHS because she had such a wonderful manager.
Yeah, sometimes this is you shouldn't put it negative.
Yeah, absolutely. And then, you know, many trusts now who have paid for their physios and occupational therapists to come on the SEPA training. So the evidence is there. They can see that it's effective. In fact, was it last year or the year before, we had four physios that were paid for by their trust. And then down the line, they asked me to go and give a half-day talk to the rest of them there. And I'm doing exactly the same to another trust in the Hull region, I think, so in Yorkshire. And I just remember that because I've been away for 2 weeks. I'm thinking, oh, yeah, I must remember that. And can't remember when it is. In November sometime, I think. But so they are out there, and there are some trusts that are moving with the times, and others, unfortunately, who are not. And I suppose that very much is dependent on who's actually leading those pain clinics as much as anything else. Time to make a change. Maybe you have to make a change, don't you? You don't know. You'll well be able to make a change.
I'm also planning on maybe going to Australia for a year or two. So I'm just wondering if I could do that privately over there. But it's still a skill set, isn't it? That I can still help chronic pain.
We've got probably had about 5 or 6 who trained with us in Australia. Okay. So yeah, absolutely, they're doing this over there as well.
And it's more private anyway. So yeah, lots to think about.
There is. It has to be, excuse me, the right time for you, and you to consider whether you feel this is the right course for you. And it's a very individual thing.
Yeah.
Anyway, right. Well, we'll leave it at that, I think.
Yeah, thank you.
Very much for your time.
That's all right. I hope that's answered all the questions that you had. By all means, email me if there's anything else.
Lovely. Thank you.
All right.
Thanks, nice
to meet you both.
Bye-bye.
Bye-bye.